This hearing is not just about determining why Dr. Monarez was fired and why Dr. Howry and other scientists at the CDC resigned. The issue is deeper than that. It is about Secretary Kennedy's dangerous war on science, public health, and the truth itself. Unacceptably, we now have an HHS secretary who does not believe in established science and who listens to conspiracy theorists and ideologues rather than doctors and medical professionals. It is absurd to have to say this in the year 2025, but vaccines are safe and effective.
Today should not be about me. Today should be about the future of trust in public health. On the morning of August 25th, Secretary Kennedy demanded two things of me that were inconsistent with my oath of office and the ethics required of a public official. He directed me to commit in advance to approving every ACIP recommendation, regardless of the scientific evidence. He also directed me to dismiss career officials responsible for vaccine policy without cause. He said if I was unwilling to do both, I should resign. I responded that I could not pre-approve recommendations without reviewing the evidence, and I had no basis to fire scientific experts. He told me he had already spoken with the White House several times about having me removed. Vaccine policy must be guided by credible data, not predetermined outcomes. As I wrote in my September 4th Wall Street Journal op-ed, I agree with President Trump. We should not hesitate to ask for proof about our vaccines. And I also agree with his most recent comments that vaccines are not controversial because they work. Demanding evidence is exactly what I was doing when I insisted CDC recommendations be based on credible science. I could have stayed silent, agreed to the demands, and no one would have known. What the public would have seen were scientists dismissed without cause and vaccine protections quietly eroded, all under the authority of a Senate-confirmed director with unimpeachable credentials. I could have kept the office, the title, but I would have lost the one thing that cannot be replaced, my integrity. Some may question my motives or mischaracterize my words. That is part of public life, but I am not here as a politician. I'm here as a scientist, a public servant, and a parent committed to protecting the health of future generations.
Instead of promoting vaccines, the Secretary spread misinformation and promoted unproven treatments. CDC's labs and data systems are our nation's first line of defense against pandemics and biothreats. But those defenses are being weakened. Under the Secretary, global flu sample submissions have dropped by 60%, and COVID samples by 70%, leaving us with far less visibility into what's coming. Trust and transparency have been broken. Here again, the problem is not too much science, but too little. I first learned that the Secretary had changed our CDC COVID vaccine guidance on an ex-social media post. CDC scientists have still not seen the scientific data or justification for this change. That is not gold standard science.
What keeps you up at night? What keeps you both up at night, very concisely?
The next outbreak, and I don't believe that we'll be prepared.
I'm concerned about the future of CDC and public health in our country. Given what I have seen, if we continue down this path, we are not prepared, not just for pandemics, but for preventing chronic health disease, and we're going to see kids dying of vaccine-preventable diseases.
You have to be unhinged to take a gun and fire it into a medical building. But these conspiracy theories about vaccines and about the people who are recommending vaccines, I fear they come with consequences. Do you fear for the safety of the CDC and of medical personnel if these beliefs about the CDC actually recommending things that hurt people continue to become mainstream?
I do worry about that. I myself was subject to threats, and I am very concerned that the further promulgation of misleading information will undermine not just the safety and health of our children, but it will also exacerbate some of these tensions, the willingness to commit harm if someone is affronted by a belief that the people like us that are trying to help them are actually not trying to help them.
Each bullet was meant for a person, and each of my staff were very traumatized afterwards. I had staff that were covering their kids in the daycare parking lot. There were people that were out at the ride share as bullets were passing over their head. I have many that won't speak about vaccines now and have removed their names off of papers. They don't wish to present publicly anymore because they feel they were personally targeted because of misinformation.